Welcome, ladies and gentlemen. This presentation is about standard setting in assessment situations. The issue of standard setting is always a little bit of headache. What I will do is present you the following. The fundamental problem in any standard setting exercise is that we want people who are competent to pass the test, and equally people who are incompetent to fail the test. Conversely, people who are competent should not fail or be incompetent and pass. The false negative and the false positive decisions need to be minimized. Although this is an easy exercise, in actual reality we have a big problem. The big problem is that we don't have an external standard against which we can validate the pass score as we set it in a test. So therefore we have a problem, and there are many different standard setting methods. However, in the absence of a gold criterion of a true external validity measure, any choice is somewhat arbitrary. And what is actually being said is that some arbitrariness can never be prevented in any method of standard setting. And therefore the credibility of the procedure is at stake. This is the criterion against which we judge standard setting methods. What is the credibility of the procedure? And that's exactly what I'm going to talk about. Here's the overview of the presentation itself. I will first go through two applied cases of two institutions using two different methods of standard setting, and will show you what sort of problems that we encounter in and what we should reconcile in further evaluation of the different methods of standard setting. And then finally we will draw some conclusions and some implications. Okay, let's look at a practice in Maastricht. But before we do that, I should explain a general distinction which is made in standard setting. An absolute standard or a relative standard. These are two categories of standards that are classified. In an absolute standard, a passing score is dependent on some mastery of study content, sometimes also called criterion referenced testing. In a relative standard, the passing score is dependent on the performance of a reference group. The reference group may be the peer group, maybe a past performance group, or any other external group on which performance is used to establish a standard. Generally speaking, absolute standards are easy to defend. People like them. And relative standards are more difficult to defend, and people dislike them. However, if there's some sort of problem around the quality of the education delivered, around the quality of the test, any sort of noise in the measurement, absolute standards will not really correct for that, or at least partially, as we will see. And relative standards have the virtue of correcting for all that variability in educational practice. Okay, let's now turn to these cases that use a relative and an absolute standard, and I'll show you the kind of problems you run into. The case of Maastricht. In Maastricht, a long time ago, we used the so-called Vleuten method. The Vleuten method is a relative standard that uses the average of the score distribution as a reference point. Why the average? The reasoning is that the average performing candidate is okay, will do his best, will perform well, so therefore the average score can be taken as a reference point. Subsequently, one chooses a rather arbitrary cutoff score below that mean, and this has been the 2 times standard error of measurement rule that has been defined as an arbitrary cutoff. Below that point, you fail the test. Above it, you pass. Why the standard error of measurement? The SEM is a reflection of the standard deviation of the test and the reliability of the test. If the reliability is poor, the standard will be lower, more people will pass. If the reliability is high, the standard will be higher, more people will fail. This has been documented in research and in a PhD dissertation at that time, and we used it in all our block tests. Our block tests are end of unit tests consisting of multiple choice questions. For every test, a new set of questions is developed. If we apply the Vleuten method to the data, we get the following picture. Here are the passing scores of the first year block tests. For Unit 1, all block tests across a number of academic years are displayed, and the same for Unit 2, and so on and so forth. I'll give you a minute or so to look at the results and try to see if there's a pattern. Actually, when we looked at it, we couldn't find any pattern. And as you see, the variation is tremendous. For example, there is a cutoff score which is as low as approximately 15-16% of the correct minus incorrect score. And on a different test, a couple of years later, the standard is as high as nearly 50% correct minus incorrect. The difference is huge. Mind you, every new test, there are new items, the curriculum hardly changes, and as you see, there's no specific pattern. These are year 1 passing scores. If we continue for year 2 scores, the same sort of pattern emerges. The conclusion is very, very wide variability. Year 3 passing scores, the same result. There's no pattern. One might argue that the scores, the year 4 passing scores, a hypothesis might be that the differences in a relative standard might be influenced by the group score, by the average. And for example, it might be a hypothesis to think of differences between cohorts as an explanation for these varying passing scores. We looked into that. Suppose we were to put all the block tests of a given cohort as the indication of the ability of the cohort, and then look across different tests and see the variations within a cohort, across students, across tests. And if we disentangle these different variance components, these sources of variance, we get the following picture. The far majority can be explained by student variance, which is logical. That is what we want. We want to make a distinction between the bright and the poor scoring students in our population. But interestingly, the cohort variation is virtually 0. So here goes our hypothesis. It is not the cohort which makes the real distinction in passing scores. So what is the problem? Let's look at a different case, and we move up to a different place, a different medical school in the Netherlands, Groningen.